Good morning. I'm Dr. Natasha Iyer, and this is Dr. Shabnam Daskar, our Director of Medical Education at Live Younger. I'm so excited to have her with me. Suzanne Somers just passed away, and it's such a hot topic. You know, people are remembering their childhood star and talking about her passing. And I thought, no one has done more to promote bioidentical hormones, the role of hormones in healthy aging, and how hormones can make such a huge impact in improving women's health and quality of life than Suzanne Somers. I mean, she was everywhere. She wrote 8 books, and this book was really transformative in our practice because once Suzanne Somers released this book, we had a flood of patients coming in back then in 2008 asking about bioidentical hormones and looking for bioidentical hormones, considering that the medical establishment was so anti-hormones, because this was on the heels of a study that said hormones are bad and they're going to kill you. And doctors thought, what is this bioidentical hormones? It's a whole bunch of baloney. Here's a movie star who's not a doctor trying to sensationalize things. And I think that it was a very, very valuable contribution to women's health that Suzanne Somers made. So, you know, as sad as it is that she's passed away, her legacy and now resurrecting her legacy because of her passing is huge. And I think it's a great conversation to have to clarify, you know, what are bioidentical hormones? Why is hormone balancing useful? And is there any truth in it? Or is it a movie star making it just sensational because she has access to things others don't? The answer is yes, you all have access to it. And then is it going to cause cancer or not? So, Dr. Carr, what is a bioidentical hormone?
So a bioidentical hormone is a chemical structure of a bioidentical hormone is exactly as the one naturally made in our body. So for example, we have estrogens and we have progesterone. Now, estrogens are 3 different types. The most potent estrogen is E2 or 17-beta estradiol. So 17-beta estradiol is what our bodies make naturally. And when women are given hormone therapy with 17-beta estradiol as a cream or a patch or a gel, depending, that is bioidentical. And so the chemical structure of that one is exactly what our bodies make. Mm-hmm. Next comes the second bioidentical hormone is progesterone. So again, that is the same progesterone that our bodies make, and this is not the progestin. Now, this is a very important distinction because very often, even in academic articles, I find that they use the 2 terms interchangeably.
I know you've written to authors of articles in published medical journals asking them to be clear about what they actually were talking about. And then you come back to me and say, oh, don't pay attention to that article because they confused a progestin and they didn't clarify what they did. So we're not using that study to influence our clinic protocols. And so that's why you're so valuable to our team, right? Because it's you do things like that, whereas other people just read an article and take from it. And it's just, you know, one thing that's important to talk about is how the media play a role. Because when the WHI was released, it was hormones are bad. Oh my God, women are dying. It's got to be stopped. But 10 years later, when they discovered that hormones were actually very useful, and now that the NAMS position statement has how many recommendations for areas that hormones make a difference in life, and it's not just for, you know, your vagina and your hot flashes, it's for so many other benefits. I mean, we have all of this. Where's the newspaper articles? But if someone else like Suzanne Somers came along and started talking about this, we would see it come up more in the media, and then people would be properly educated. So thank you for pointing out that difference between progestin and progesterone, because they are very, very different.
So the biggest problem is, again, here, you know, clarification is very important because people will read, you know, an article saying bioidenticals are harmful. No, there are bioidenticals which are prescription products. The challenge, and Dr. Iyer and I both agree with, you know, with the argument against it, is compounded bioidentical. So these are specially formulated in compounding pharmacies. Now, we are very fortunate to have access to very high quality compounding pharmacies. So, Natasha, this is not the case all over the world, you know.
I know, because you won't prescribe in Asia.
No, I won't prescribe
Right. So
unless,
the quality of
yes,
compounding here, and the pharmacies that we refer to have third-party testing. They
yes,
can prove that what they made is what we say we're giving the patient.
yeah,
And an independent company looks at the quality of how they make the medicine so that you can be assured that it is what it says it is. And I've had an issue with compounding pharmacies before, which is why I stick to the ones I know best, because I had a patient on compounded thyroid, and every time we checked her, her levels were all over the place. And it turned out it was an issue with the compounding,
yes,
not the prescription or the patient's body or whatever. And when we changed pharmacies, we saw the difference when you go to someone who uses third-party testing and follows all the rules and focuses on the quality of what they're producing. So bioidentical hormones are identical to our own body, and it looks exactly. So they do come from plant molecules, plant sterols that are adjusted to show the to make it look the exact same molecule as to what our body uses
yeah,
and makes and uses. So it's
yeah.
familiar, so that's why it's called identical. A synthetic molecule, and I don't know if you want to try and pull up a picture, because I know you got a picture
Oh,
somewhere.
I
And if you can, then we'll show it later. If you can't,
yeah,
no problem. But this is what I wanted people to see, especially between progesterone and progestin, because when the WHI was released and they said women are dying, it was the arm of the study that used a synthetic artificial molecule that is foreign to women's bodies. No wonder we had side effects and issues with it.
yeah.
So that covers the bioidentical hormones. Now, Suzanne Summers talked about all of the things that it did for her, and she said her depression went away and her skin improved. And what were some of the other things she was talking about? Oh, she has sex 3 times a week in her
Libido,
60s.
yeah.
70, no, sorry, twice a day. Sorry.
Mhm.
So, I had a patient mention that to me. She was like, I can't believe this now that she's dead. They're sensationalizing how often she had sex. And she was
Isn't
having,
that supposed to be good?
that is a good thing. And that's the whole point, that, when your body is in good balance, your sex drive is the key performance indicator of complete wellness. You don't have a great sex drive, and let's not make sex taboo. It is a thing.
Yeah,
It's an important part of life, and women can't have good quality sex when they're hormone deficient.
yeah,
Right. And so when you think about it, we used to only prescribe hormones for vaginal dryness and for urine issues, which is not as common as it should be,
it's
considering how many
actually a very important, missing piece, because you brought up something, urinary infection in older women, you
is
know,
very common. When I
very
do an
common.
ER, I still cover the
Yeah,
emergency department every once in a while. And I will tell you, the number of women that come in with urine infections after age 50, and I'm telling them to go ask their doctor for
yeah,
hormones. And, even if you're a traditional medical doctor, and even if you don't subscribe to bioidenticals, the treatments available for vaginal preparations to help the bladder and the vagina improve in hydration and function, they work and they're bioidentical. If you look at
yes,
17 beta estradiol, it comes as a pessary, it comes as a cream, it comes as a patch, it comes as a gel. And sure, it's not the full spectrum of hormone balancing that we would do with a woman in functional medicine, but at least it's going to improve sexual function. They stop waking up at night to pee all the time, and it reduces the incidence of infections of the bladder, which then end up going into the kidneys. And you've got all this increased disease burden from one simple thing that could have been done. So sorry,
yeah.
I went
No,
off
it's
on a tangent
Natasha, you
there.
brought up something very important, because recently there was an article which said, vaginal dryness can kill. And then I think they
I
added
saw
a
that. Yes,
tagline,
Medscape. And they were
seriously.
like,
Yeah.
vaginal dryness kills women. And I was like,
Yeah.
absolutely. I mean, some women who, sorry, no, I was going to make a bad joke about orgasms and killing you. But yeah, it would kill me if I didn't have an orgasm. But beside that, it's more about the risk of infection and kidney infections and hospitalization in older women. And
Yeah.
truly, all it needed was for women to know and to ask for hormone replacement therapy early. And when she said it helped her depression, of course, hormone balancing helps mood. And we talk about progesterone
Yes.
being a neurosteroid. So if you have the picture, pop it up whenever you
Oh,
can.
I
And
don't want to
if
waste time
you
because I
talk
have to
about
give quite a bit
progesterone
for it.
being a neurosteroid, it's very important for sleep, for mood, to calm anxiety. You don't have an Ativan or a Valium deficiency. You have a progesterone deficiency that starts in, actually now it's starting in your late 20s and early 30s, where women are dropping their levels of progesterone. It could also be that they have normal progesterone, but now they have estrogen dominance and they feel low in progesterone. But that's a whole other topic for a different day. But the amount of progesterone that your body feels it needs is lower, so your mood gets affected, your sense of calm gets affected, your brain gets affected. So hormones have more to do with the whole body than just your vagina and your sexual function. But that being said, she talked about it. She talked about her mood improving, and it made women say, maybe I should look at hormones instead of being on an antidepressant for the rest of my life. And that was
Yeah.
beautiful. The other thing she talked about was her skin improving. In the perimenopause, women lose 30% of their collagen because their estrogen levels are changing. And so you and I are often told we don't look our age, but we started hormone replacement therapy as soon as our levels started changing. I mean, for me, I didn't notice until my brain just stopped. And remember, I said, my brain's broken. What's going on? And you said, maybe we should check your hormones. And it was like, oh my God, I need estrogen. Right. And so, we've had those conversations a lot about brain function and estrogen, but I certainly haven't experienced the skin aging that women in their 50s experience. And you're, sorry to say, but you've got a few years on me, and you haven't experienced it either. So, there's great value in having these types of conversations to educate women.
Yeah, so I'm just going to recap what we covered, and then we'll talk about whether hormones
Cause cancer.
cause breast cancer. So, number one, what are bioidenticals? There are prescription pharmaceutical bioidenticals, and there are compounded bioidenticals. So, the compounding pharmacy, quality of the products they make, and compounding is not easy. It's remember, we talked to so many compounding pharmacists who say, and it's so expensive as well to compound it properly. So that is the other thing. The most important thing that Natasha talked about was about Suzanne Summers and how she brought about all this awareness about hormones, about bioidenticals. Another thing is, you and I talk about WHI study. We forget that sometimes people may not know. So the
Yes,
WHI
please.
study is the Women's Health Initiative study. This was in 2003. And that was actually that study caused a lot of problems for women, I would say, today. And this is acknowledged by people who know what is going on. So that study looked at women on hormones. And then, Natasha, you faced that backlash,
I had
So,
just moved to Canada well, no, I moved here in 1998 and started working in a family practice and my whole
yeah,
rural emergency medicine practice. But I remember when that study came out, and we were, because it was headline news and
yeah,
everything, and it was like, pull women off of their hormones, don't renew it.
yeah.
And I remember the female physician that owned the practice that I worked in looked at me and said, I do not want to end up in jail. So if you ever took my hormones away from me, I would end up killing someone. So I am not going off this. I would rather die of cancer than end up in jail. And I remember that because I was in my 20s, right? And I was just, so oblivious to hormones and
Yeah.
women's health issues. And I was in my 20s. I learned about it. I was a resident in obs and gynae at one point, and here in Canada even, right? And so I worked in a menopause clinic clinic, but it didn't matter to me. It was all just theoretical. And by the way, in the menopause clinic, this is what we did. Women would come in, they'd have hot flashes and all these things. We never paid attention to sleep, mood, anxiety, anything like that. It was all about hot flashes and vaginal dryness. So the prescription was Premarin 0.3 milligrams.
And Premarin is not a bioidentical hormone.
It's not. It's bioidentical to a horse, though, Dr. Carr,
Yeah.
but it's not bioidentical to humans. Although being natural and in the WHI, what did we see? Something naturally derived is less harmful to women than something synthetically created by a pharmaceutical industry, right? So we gave them 0.3 Premarin. If it didn't work, we doubled it to 0.625. If that didn't work, the next prescription up was 0.9. And if that didn't work, we gave them an antidepressant and said, see you, goodbye. If they had a
told them they're
uterus,
getting old.
if they had a uterus, we gave them Provera, which is the very synthetic thing that you're talking about. We never used Prometrium at the time. You know, and Prometrium, it's a pharmaceutical, but it is bioidentical. We don't love it because it used to have peanut oil. Now it has soy oil, and those are two oils we don't want women on, you know, inflammatory and different conversation for a different day. But at least the hormone it contains is bioidentical, meaning identical to your body and what your body has seen your whole life. So taking something your body has seen can't be worse for you.
Yeah.
There are some caveats to that where bioidenticals can be unsafe, and we'll talk about that in a moment. But that was the menopause clinic, right? And then here's a woman in real life looking at me and saying, I don't care what the studies show. This has changed my life. And you and I are of the same opinion now that we're in our 50s, right? So here's a woman saying to me in my 20s, I will kill someone and end up in jail if I stop hormones. And so there's no way I'm doing that.
Yeah. So one thing I just want to clarify, the WHI study, women were on a completely different oral estrogen and a progestin, which we have explained. Both of those are not what our bodies make. Hormone therapy has changed dramatically today. Today, the recommended hormone therapy is 17 beta estradiol, which is bioidentical, to be applied on the skin as a cream patch, or even vaginally, depending on, you know, what kind of outcome you're looking for. And the progesterone component is also progesterone and not progestin that was used in the WHI. So the WHI study found, you know, women were dying earlier because of heart disease and breast cancers. The breast cancer was associated with the progestin. That was
and
also,
they found that out in hindsight,
yes,
right? And
so
yet
it's
in
a
the
very
media,
different
there was
hormone
no big
therapy.
publicity saying, oh my God, the study was wrong, it's different now. You never heard about it. And so doctors never heard about it. And so they continue to deprive women of hormone therapy, which is life-saving and life-changing. And for me, life-changing is more important than life-saving, because right now I care about what's happening right now. So I want my brain to work. I want my other bits to work well, right? And so, you know, it's easy to think that, especially if you're a man prescribing hormones, it's so easy to say, oh no, that's going to hurt you and whatever. I guarantee you, if men's testosterone dropped to a point where it caused all of these, which it does, but they don't know this,
it does,
right? But if men were affected like women and they could not have good sex, every person would be on testosterone replacement therapy as soon as those levels dropped, right? And so, you know, we need to educate women. And so this is a wonderful time to talk about it.
So the most important question is, can hormone therapy cause breast cancer? The answer is it would depend on what type of hormone therapy. The hormone therapy that is recommended today, the one that Dr. Iyer prescribes, the one that I prescribe when I can. I don't have the advantage of your compounding pharmacy. So that is very different. That cannot cause breast cancer. And the other important question is, Natasha, there are a lot of survivors of breast cancer now because, you know, breast cancer prognosis has changed dramatically, particularly in first world countries. So this is the next question. Number one is the doctor who prescribes hormones for you has to know the stuff very well. Now, there are studies where they are using vaginal estrogens for, genitourinary symptoms of menopause in women who have been treated for breast cancer. And this is where Dr. Iyer and our opinion is a little different, in the sense that you'll find it's being said that when you use hormones in the vagina, they don't show up in the blood, so they don't have any effect in the rest of the body. That is not entirely true, because if it is relieving symptoms in the vagina is very it's got a lot of blood vessels. So obviously it is getting absorbed in the body, but it doesn't show up in blood, and that's the reason we have to do saliva testing, because saliva can detect those levels at the tissue level. So you'll find people talking about, oh, they
I
just...
want to pause you there. I want to pause you there. So what Dr. Carr is talking about is there are many articles released saying it's safe to use vaginal hormone therapy because it's local to the tissue and you don't have to worry about systemic effects and it having impact on the rest of you. And what Dr. Carr is saying is, even if you put it in your vagina and it takes away your hot flashes, it has gotten further than the vagina. And so we know in functional medicine that anything you put on the skin gets to all of you. However, when they're releasing these drugs and saying it's okay, the drug being 17 beta estradiol or Vagifem or whatever you want to call it on its trade name, they're saying it's safe because you cannot find it in blood. Yes, you cannot find topical hormone therapy in blood. That is why we do salivary testing for hormones when we treat patients, because it is about the balance. And I want to clarify one other thing you said. You said they don't cause cancer. They do. Even a bioidentical hormone can play a role in cancer formation. So I want to be very clear about this one thing. When your body makes estrogen, okay, it makes estradiol, and then there's a pathway between estradiol and estrone, which is considered a more potent estrogen. And then there's a metabolite downstream of estriol, E3 we'll call it, just for simplicity. So we have estradiol and we have estriol, E2 and E3. They have different areas that they work best on. So estradiol works best on the brain and the bone. Yes, it has some effect on your vagina and what you call genitourinary symptoms. We'll clarify that. So genitourinary is a medical term, and it's talking about symptoms of your bladder and your vagina. So when you use estradiol vaginally, it does help that, and it helps the rest of you. We prescribe estriol as well because we know, as Dr. Carr said, there was an article called Estrogen Kills. And I mean, sorry, you said vaginal dryness kills. And it truly was the title of the article we read. And it said women are dying from lack of estrogen because they get more bladder infections. And so when we're older and you're not on hormones, it's killing women. So estriol, estradiol, that's the thing that we look at, and we do salivary testing to test. But if you don't metabolize estrogen, either through your genetics, because you have a high toxic burden, there's other issues in your body, you can have pro-cancer metabolites come from bioidentical hormones or your own. So what I don't want women to think is, I'm taking bioidentical hormones and I'm not going to get cancer. You could, and I would say that it's a double-edged sword to say they do cause cancer, because 1 in 8 women are going to get excuse me, breast cancer, regardless of being on hormones or not. That's the statistic right now. So if we had to explain that, then again, we're looking at estrogen metabolism and these metabolites that are not methylated, which is, again, we should do another conversation on what that is and why it raises risk. So as much as bioidentical hormones are natural, if they don't metabolize in your body and we're not watching it, we can see an increased risk for breast cancer. Oh, excuse me. Which we can mitigate against, and we know what to do in functional medicine. But don't ever think that I can just take bioidentical hormones willy-nilly and not manage it and not test it and not follow the metabolites and be safe forever.
Thank you, Natasha. Let me clarify what I meant. And, we live in our own bubbles. So I'm talking about safe hormone therapy. So safe hormone therapy does not just involve, renewing a prescription every 3 months, just slather some hormones, pop some pills, and you're good to go. It's not that. So what Dr. Iyer highlighted is very important, the right kind of hormone therapy. Obviously, if you are on super high doses of estrogens or progesterones, and if you are not followed in saliva, it is only in blood that is being checked, and that has so many patients have come to you like that, Natasha. That is not safe hormone therapy. And the other thing is E1 that you mentioned, estrone, that is called a potential carcinogen by the, I forget which authority. So that E1 is the estrogen which we never replace. That is never to be replaced in any woman. That is the one that is associated with cancer. And Dr. Iyer talked about the metabolites. So we actually test for those metabolites and how you metabolize estrogen, whether you are, this is the natural estrogen in your body or the one that is being replaced as hormone therapy, that decides your breast cancer risk to a great extent. Now, there are multiple other factors as well, but in regards to hormone therapy, number one, safe hormone therapy is not super high doses of estrogen or progesterone, which is managed based on your symptoms. That is not what we are talking about. Number two is how you're metabolizing estrogen. And that is why, when someone comes to Dr. Natasha, so many times you've had patients who just want a hormone prescription and you just tell them, no, I'm not the right doctor for you. And the other thing is rest of lifestyle, what you eat, that has a huge impact because estrogen is metabolized in the gut. But we're going to talk about all those on, every time we keep saying we talk about everything else. So number one, you need the right information. Hormones will not kill you, but at the same time, there are caveats. There are hormone-dependent cancers. At that point, you cannot use hormones. And most importantly, women should be given the right information so that they can make the decisions for themselves and not be told, don't take hormones, they'll kill you.
Mm-hmm. Thank you, Dr. Carr. I hope this was enlightening and eye-opening for you, and you'll feel free to have more conversations about the role of hormones and whether you need them in your life or not, because Dr. Carr and I both believe that hormone saves lives and that every woman should be on hormone therapy.
Thank you.
Even regardless of your risk, because those can be investigated and managed. Like my mom had breast cancer, her sister had breast cancer. I take hormones. I don't go, everyone in my family, and truly I have more people who've had hormone dependent cancers, but I'm not saying I'm not taking them because I'm going to get cancer. No, I can manage my life. My genetics are not my destiny. I have more than 80% control over whether I get cancer or not. So I'm going to take hormones and feel amazing.
Thank you.
Look younger too.
Yes.